Cyclothymia would be the milder form of bipolar disorder. Mrs. McDonald has experienced a 12-year history of periods of feeling great followed by periods of feeling lousy. During her feeling great periods, she experiences increased sexual drive, euphoric mood, and increased irritability. During her feeling lousy periods, she experiences insomnia, fatigue, and low self-esteem. What we have here is that Mrs. McDonald is experiencing episodes of depressed mood characterized by the insomnia, fatigue, and low self-esteem, with episodes of hypomania, where you have the increased sexual drive, the euphoric mood, and the increased irritability. None of these reach the level of major depression, nor do they reach the level of mania. So what you have is a fluctuation between depressed mood and hypomania for more than 2 years, and that is what makes it cyclothymia. So it is basically a milder form of bipolar 2. Bipolar 2 is where you have hypomania and major depression. Bipolar 1 is where you have major depression and mania. And bipolar 2, the experts think, are much more common than bipolar 1. Now, as far as the risk factors for cyclothymia, most of these patients tend to have problems in their interpersonal lives. Many of them will have other personality disorders like the borderline personality disorders, and I'm sure many of them will abuse alcohol and drugs. And again, they're regulating their mood with the use of these substances. And as is true for dysthymia, the treatment of choice for cyclothymia will be individual psychotherapy. Should psychotherapy not suffice, then the treatment of choice becomes pharmacotherapy, and the mood stabilizers like lithium or valproic acid would be the ones that would be indicated in the treatment of this disorder. And the differential diagnoses, of course, will be the use of drugs and other personality disorders. Let's review some mood charts. The first one that you see here is normal mood. So what you see is on one axis you have mood, on the other axis you have time. That straight line that goes across is what probably most of us experience. We do have good days, we do have bad days, but I'm sure that over time all of these days even out, so you have a basic straight line. When you have a dysthymia, what you're looking at is at the time axis you see at least 2 years. So what you start off with is a patient who starts off with a normal mood, then you see a decline in the level of functioning. However, that decline does not go all the way to the bottom. So their functioning is not that impaired, the symptoms are not that severe, but you do see that mild deterioration that lasts a long time, and that is what dysthymia should look like in a mood chart. Cyclothymia is where you have the hypomania and the depressed mood. So if you notice the hypomania, the mood axes, you're going to see an increase or an elevation in that axis. However, what do you find? That it does not go all the way to the top. So therefore, it is not full-blown mania, but a hypomania, which means your symptoms are not as severe, your functioning is not as impaired. And the same holds true for the depression. So you have mild mania, mild depression for more than 2 years, and that is what cyclothymia consists of. Major depression, the natural course of the illness, when it is by itself, not in bipolar, but in major depression, is approximately 1 year, which means that most patients, whether they get treatment or not, will tend to improve within 1 year. The difference between a major depression and a dysthymia is I want you to look at the severity of the symptoms and imagine the level of functioning. This is one that goes all the way down. So this is definitely a depression. You're not working, you're not getting anything accomplished, but you notice that by 1 year or less, you go back to normal, and that is what the major depression would look like. Here you have one for bipolar disorder. So how do we know it's bipolar disorder? You're going to find the full-blown mania. Notice how that line goes all the way to the top, indicating that it is a mania. The natural course of mania is usually 3 months. But why are we so aggressive in treating mania? Think of the damage that these patients can cause if their manic symptoms go untreated. So what you have here is a patient within 3 months go back to normal, and because it's a full-blown mania, what we have here is a bipolar 1 disorder.